When can I sign up for these Part C plans? Just like the other ones, 313, initial enrollment. When I first start Medicare, I have original Medicare A and B. I can sign up for a Medicare Advantage right then if I want. If I don't sign up for Medicare and I have to wait to the general enrollment period to sign up, same thing. I can always sign up for a Medicare Advantage right then and there. I always have special enrollment periods if something crucial in life happens that's out of our control. Otherwise, just like with D, you'll have to wait till the annual open enrollment period. Remember I said that's a time anybody can do anything. So starting October 15th, if I got original Medicare, I can switch to a Medicare Advantage. I've got Medicare Advantage PPO. I want to switch to an HMO. Annual open enrollment period, you can make any changes you want. One thing that is good that's out there, let's say, for example, this open enrollment period, you've got original Medicare, and it's costing you quite a bit of money. And you say, well, I might want to try one of these Medicare Advantage plans. I might want to try an HMO or a PPO. I'm really not sure. Well, there's now a period called the Medicare Advantage Open Enrollment Period. It runs January through March. So let's say, for example, I decide I want to try an HMO. January 1st, my HMO starts, January 1, 2021. I'm beginning the Medicare Advantage Open Enrollment Period. Anytime from January through March 31st, at any time, if I decide I don't like that HMO or PPO, I've got this Medicare Advantage Open Enrollment Period. I can switch. I can go back to original Medicare and get a Part D. So it kind of gives you that flexibility. If you want to try one, you can. You got 3 months to try it out. You can switch back during the first 3 months of the year. So, you know, they've added flexibilities if people want to try those plans. So these are the enrollment periods there. All right, how do we find these plans? The easiest way that we do it, and it's also available to you, is using the Medicare Plan Finder. You go out to medicare.gov and you click on the Plan Finder link. They just redid this whole system last year to make it easier for the general public to use. Now, how do you get the best results? You get the best results by creating a My Medicare account. Just like the My Social Security account I told you about, if you already have a Medicare number, you can set up a My Medicare account and you can track and do a lot of Medicare things right there. And what you can do with your Part D plan is you set up this My Medicare account, you put that information into the Plan Finder, it will automatically come up and list all the drugs you've used through Medicare in the last 12 months, and you can look at it and change it and modify. If it's not what you're taking now, you can save all that, and you can see all the prices and everything based directly on you. There's also, if you're getting that extra help program I told you about, that will show. You can go in and see your Medicare summary notices. If you have original Medicare, you can go in and track all those preventive services that you had. So the Medicare Plan Finder is the most detailed and specific way to get your Medicare plan options and your choices. Now, you can go straight to plans if you want. If you receive the 2021 Medicare and You, all right, all the plans are listed in the back of there, but you're going to have to call the plan to get all the details. It never hurts, even if you go through the Plan Finder, it never hurts to call the plan for details. But I definitely, if you call us and want to look at drug plans, we're going to want to help you create a My Medicare account. We'll put that information in. We'll put in your zip code because you can only have a plan that's within your area. On average, when I pull one up for somebody, on average, there's normally about 26 plans for them to choose from. All right. So you just got to, nail it down to what you want. These are just the different things that it's going to want for you to create a My Medicare account. This just tells you about creating the My Medicare account. Like I said, the representative's going to have all this stuff posted on their website. Now, another program I want to talk about for low-income people. I have been to long-term care facilities, to senior apartment complexes, and I've given these presentations. And very often I'll have somebody say, I didn't take that Part B. I only make $700 a month in Social Security. I can't afford to pay that $144.60 every month. So I can't take that Part B. Well, there is a program from Medicaid that helps people pay for Medicare. It's called the Medicare Savings Program. This is different from the Medicare Medical Program that most people have. This is a separate program. There's 3 different categories: QMB, Qualified Medicare Beneficiary; SLIB, Specified Low Income Medicare Beneficiary; or QI1, Qualified Individual. Basically, income and assets. So what it comes down to, there's 3 different levels, and it's based upon your income. If your income is the lowest limit, it's below $1,063 as an individual. Asset limits are higher for these. Your assets are less than $7,730. You can qualify this program, and it will pay all of your Medicare costs, A and B, premiums, deductibles, and copays. So if you qualify for the best program under Medicare Savings Program, you got QMB, you go to your doctor, you give them your Medicare card, you give them proof of QMB, your out-of-pocket costs are 0. If your income is too high for that, you may qualify for one of the other 2 programs. If you qualify for those, the state of Illinois will pay for your Part B, monthly Part B premium, at least. All right. So if your income's the highest one, these are the 2020, 2021s aren't out yet. But for an individual, if you make $1,436 a month gross or less, or anywhere close, because these things have deductions and things. I always tell people, if you're anywhere in the ballpark, apply. You can go to Medicaid, apply for the Medicare Savings Program. This is a Medicaid program to pay your Medicare costs. Okay? If you need more information, call our senior helpline. We can get that information out to you. All right, home stretch, guys. I know we've been going at it for a little while. COVID-19 pandemic. It's been chaos for everybody in the world. It's been really chaos for those of us in the Medicare and Social Security world. Your Social Security offices, as well as your Medicaid offices, as well as our offices, I've been working from home since March, are closed down. Now, Social Security, if you need to do stuff through Social Security, they have expanded their online services. You can do a few more things that you couldn't do before. You can go online to ssa.gov, to their online services. You can apply for retirement. You can apply for disability. You can apply for Medicare. You can check the status of your applications. You can request a replacement card. You can print and view your benefit letters, like we were talking about that gentleman earlier. The only way to really get a hold of them now is by calling. If you don't know the number, You can call their 800 number. If you don't know their number, you can go to the SSA locator at ssa.gov/locator. Now, I'm going to be real with you. You may end up waiting a little bit longer because everybody is calling. I would probably suggest the earlier you call, the better. But like I said, they've expanded their online services, and you can try to call them. They're doing everything they can to try to service everybody during the pandemic. They've even given some people extensions on some things because they couldn't get through. Okay. Oops. All right, Medicare, we're in the same boat. CMS Medicare, Centers for Medicare and Medicaid Service, is responding by making changes, temporary changes in some of the Medicare rules. All right. Most people on Medicare are at higher risk for the COVID-19. All right. They're older, they have the health conditions and all that kind of good stuff. If you need more information on the COVID-19, you can go to coronavirus.gov and get more information. I'm sure you've been flooded with it in the months that this has happened. But Medicare has made some temporary changes. Medicare Part B covers testing to see if you have the coronavirus. You pay nothing if you get it from a laboratory, pharmacy, doctor, or hospital. Medicare covers this test in your local area. It can also be covered in different locations like the parking lot testing and stuff. If you have one of those Medicare Advantage plans, the HMO or PPO, they cannot charge you co-payments for this. All right, so you can get the COVID testing through Medicare. Some other flexibilities they've added: durable medical equipment, especially because it was a high fraud area, had very strict, stringent requirements. During COVID, because they don't want people going out, they've temporarily no longer required you to see somebody face to face. You don't have to have a brand new physician's order. You can forego some of the documentation, some of the prior authorization. So a lot of this stuff can be done over the phone, and all the paperwork can be lessened. Big thing that has happened during the pandemic: telehealth. They've expanded telehealth. My own doctors, I have telehealth appointments. Will Medicare do the same thing? Under Medicare, telehealth was normally restricted to places like out in rural areas. The closest doctor was 50 miles away, or only for certain conditions. They've basically expanded telehealth to basically just about everything. So you can use telehealth instead of having to travel and put yourself at risk and go to that doctor. They've waived a lot of prior authorizations. Some Part D drugs required your doctor to authorize ahead of time. Those have been waived. They've relaxed the refill too soon edits. Normally when you fill your drugs, it's within a certain amount of days from your last refill. They've relaxed those to try to limit people going out. All right, and they've just relaxed a lot of the drug policies to discourage, Part D drugs and encourage delivery and things like that. So a lot of relaxation. Nursing homes, I'm sure you heard about a lot of this on the news. They've restricted visitors, they've restricted volunteers, they've canceled all group activities, and they've got to actively screen people all the time. Open enrollment. All right, this is where we're headed starting October 15th. Do know that you can always call 1-800-MEDICARE, 24 hours a day, 7 days a week. All right. If you call Medicare during open enrollment, I suggest calling in off hours because it's going to be real busy during the day. Like I said, they're 24/7. If you want to find a local SHIP counselor, you can use the web address on the screen, or you can call the number that also has this. I'm gonna put that at the end for you to copy down.